Sam, you are the executive director of our Brookfield location. So
I
that's really
am.
exciting. We opened on Monday. How's everything going so far?
It's going really great. So we're already treating patients, and we've had patients already tell us, like, direct quote is, "You all really care." And so it's really nice to be here, be treating patients and hearing such positivity to get us started.
Oh my gosh, I love hearing that. You all really care. That's amazing. Thank you for sharing that.
Yeah.
That is the best feedback. Okay, let's kind of rewind a little bit and let's start with your background. I'd love to hear about just who you are as a person, as a clinician. So feel free to go as far back as you want or or not. I would love to learn a little bit about you.
Yeah, so my background is actually in social work. So I'm a licensed clinical social worker and clinical substance abuse counselor. I've been in behavioral health for about 18 years. So I started my postmasters at a inpatient psychiatric unit where I treated patients who were in detox, there for general mental health, and actually I worked with the geriatric population as well, which was really unique. And then post my time in inpatient, I actually was a clinician in a PHP and IOP level of care. So I treated patients who had what we then called dual diagnosis. So had a mental health diagnosis alongside a substance use disorder. And post that, I had the opportunity to move into what was then called a lead social work role. So I worked doing supervision with clinicians. I jumped in, facilitated groups, met with patients, worked with their families. So I kind of did a little bit of everything, but that was my first step into leadership. And I found I really enjoyed it. I enjoyed helping clinicians grow in their clinical skill set. And I really enjoyed kind of seeing from a patient experience standpoint, how did all of the things that happened at the clinic fit together to make a really good treatment experience for individuals that were in need. And so then I had the opportunity to become a leader. And from there, my passion kind of grew on that process side, just making sure that what people experience when they come into a clinic is positive and it makes sense. And it's not hard for our clinical teams to do. So I actually moved into a kind of quality improvement or process improvement role and did that in a large national system for about 7 years. Then I got the itch to come back to clinical care. I really, really missed patients. I really missed working with clinicians. And so it was time, and PHP and IOP had been where I just really found myself and as a clinician, as a leader. And so I kind of wanted to full circle come back to that. And so when I heard Compass was opening in Brookfield, I was pretty excited because
Yeah.
it really fit with what I was looking for my next steps personally.
Well, that's amazing. So happy that you found your way back to it. I'm curious, could you kind of speak to, you mentioned you worked in inpatient for a while, and, we often look at PHP and IOP as a step down from inpatient. I'm curious, what did you learn during your time working in inpatient that kind of informs your work now, but also informed kind of your transition into PHP, IOP?
Yeah, that's an awesome question, Britt. And I think this is where when we talk about intermediary levels of care like PHP and IOP, it's important to recognize that when somebody is going inpatient, they're truly stepping away from their lives 100%, right? They're spending the night, they're in a facility with people they don't know, and there's a place for it, right? We need it. People that are going to need to be in a place where they can be safe and or where they need to safely detox from substances. I think there are times where we could be treating patients at our intermediary levels, a level of care where they wouldn't actually need to step away from their life and go inpatient. And I think that's one of the things I love the most about PHP and IOP is keeping people really integrated with their day-to-day life while they're seeking treatment and working on whatever it is that they're working on as an individual.
So important. I feel like not enough people really know about PHP and IOP as well. A lot of people think that if they need a higher level of care just to go to the ER or just to seek out inpatient. So it really is filling that gap, which is so
Absolutely.
great. And you spoke a little bit about really wanting to work with patients again. What is it about working with patients that you miss so much?
When people are ready to make the call to say, I need help, It's one, it takes so much courage to make that call. It can be really intimidating, it can be really scary. And when they get to the point that they have that courage to make the call and they come into treatment, majority of times, and I would say like 99.9% of the time, they get here and they find that others are experiencing the same things they're experiencing, so they don't feel as alone. They find skills that help them navigate the challenges of life or whatever it is that their particular challenge is. And being able to see that starting point of maybe feeling hopeless, maybe feeling like it can't get better, feeling like I'm alone in it, to this place of actually I'm not alone and there are really tangible things that I can do every single day to help me on this path to wellness, and these parts of myself that I can explore safely to understand in a way that'll help me be more successful in the future, in whatever my goals are. And so I think it's just really that journey that is so powerful, and to be able to have that kind of impact for literally just an individual, but then you think about it from a leadership standpoint, hundreds of patients. It's just incredible, and it's such an honor to be part of.
It's amazing. What do you like to speak to if you're working directly with a patient or you're guiding one of your clinicians, you know, in your role, if someone's unsure about starting that journey at Compass or wherever is a right fit for them, what are some things that you would say to people or that you say to your clinicians to help them coach people through
You're asking such great questions. I
it?
love this.
Oh, good. I'm glad.
Yeah. Well, and I feel like this is too simplest, too simplistic. But it's kind of like just give it a try, right? So come in, tour the space. Let's just see it, because I think sometimes we have preconceived notions about what behavioral health treatment looks like or feels like, make it feel scarier than it is. And I think when you come to the space and you feel the warmth of the clinicians and you feel the warmth of the individual that greets you at our front desk, and then you start to see the spaces, that kind of decreases how intimidating it can be. But I think some of the other things is just starting to ask questions, right? Like oftentimes anxiety is driven by fear, right? And so what is that underpinning fear that's presenting, and can we have a conversation about that? But at its base, it's come in, let's tour, let's give it a try for a day and see how you feel after that.
Love that. That's such good advice. What are some of the misconceptions you typically hear from people who may have had, you know, a vision of what Compass may look like or just mental health treatment at our level looks like before they've been into this space? What are some of those misconceptions? And then how does our space debunk those?
Sure. Well, I think kind of going back to what I said earlier, some of the biggest ones is just like nobody else is going to get it, right? Nobody else understands what I'm experiencing, what I'm going through. And that's where the just give it a try comes in, because, on day one, typically patients are realizing they're not alone and that others are experiencing things that are similar to them.
Absolutely. And especially with the group therapy model. I want to ask a little bit specifically about Compass's care model. How would you describe our care model from your perspective? We just kind of love to hear it in your words. Obviously, people can read about it on our website, but we'd love to hear it from you.
Well, I love the care model. It's actually part of the reason why I chose to come to Compass. Um, and because it's really dynamic. So the care model is going to bring together an entire interdisciplinary team, to wrap around that patient or that individual. And that interdisciplinary team is going to include a prescriber, so a psychiatrist or an APNP, a primary therapist who's going to be doing some one on one work with the individual, a family therapist. Who has dedicated time and expertise in doing family therapy, alongside an education specialist for our under 18 population and group therapists who are all master's level clinicians. And so day to day at Compass, the way that looks is that our patients are going to primarily engage in group-based therapy. And those groups are really designed to help build skills, but also to have specialized programming. So I like to think about it like going to college, where everybody gets certain grades because we all need to understand these certain aspects to help us on our path to wellness. But then you might have something that's your major, right? This is the thing that you're really working on or working towards. And that might be something like trauma or OCD. And so you're going to also get really specialized groups for those specific symptoms that you might be experiencing. And so we have skills based groups. We have art therapy or experiential therapy groups for our under 18 population. We have group called Academic Skills Integration, where we're actually helping patients maintain their schoolwork and also having a clinician partnered with that group. So if they're getting anxious or experiencing distressing emotions while they're working through their schoolwork, we can navigate both school and kind of those emotional or symptomatic components. And then we have mindfulness groups. So those all kind of come together in a package. And we do that just on a rotation. So those groups are happening in different rooms throughout the course of the day. And depending on your specific needs, you might be in room one today, you might be in room two tomorrow. So it's really neat that we can tailor the groups to an individual's specific needs. And then as those groups are occurring throughout the day, our primary therapists are pulling patients from the group to do their individual sessions with them. And those individual sessions are really skills based. So it's really designed to say, what are you experiencing at home? What are you learning in group? And how do we pull those together and create goals around that and check in on those goals? And then the same thing for family. So family therapists might be pulling from group. They might also be scheduling a little bit earlier before group starts or a little bit after group ends with whoever the primary support team is. Our provider team will meet with the patient 2 to 3 times a week in PHP, 1 to 2 times a week in IOP. And their goal really is to check in on the medical side of things and their medications to see if all of that is working for them or if an adjustment would be helpful. So, the other thing maybe to note is that our clinical team feels really passionate about being great community partners. So, if our patient has a current prescriber in the community or therapist in the community, our primary therapist and our providers are going to be calling them to coordinate care and make sure that we're all really synced up to what's best for that individual patient.
I know we know that this model works, and we have, the data to support it. Can you speak a little bit to that and, really why this model is so effective and how we know that it's effective?
Yeah. So the way that we know it's effective is that we do outcome measures. So a patient gets an outcome measure at the beginning of treatment and at the end of treatment, so we can see with data and facts that there's a change in symptomology. So we know our program works, which is really exciting. Um, and I think all of us clinicians that are secret data nerds really like that part of Compass's model and care. And I think we all feel good about the ability to say very tangibly to a patient, hey, you came in with a GAD score of this, and you're leaving with a GAD score of this. Because I think as those changes are occurring for patients, we don't always really feel how big they are. And the data can help us really explain that to patients and help them celebrate in that success. So that's how we know that it works. Then I think the secondary thing is the data and facts are good. And we also know because patients tell us, right? So they'll share with us that they're feeling more hopeful, that they're feeling less anxious, they're able to get out of bed and go places. They're more engaged with their family. So we know it both in data, but also in kind of that subjective, air quotes, because I don't think anybody's experience is ever subjective, but patients let us know. Why do I think it works? Well, one, I think we have a team of really talented and caring individuals that are here for patients. And when patients feel that their team is behind them, and that they're truly there to help, I think that's one of the biggest hurdles. And then I think secondarily, we use evidence based treatments, right? So we're using cognitive behavioral therapy. We're using dialectical behavior therapy. We're using acceptance commitment therapy and exposure and response prevention, which we all know are effective treatments. So, um, yeah, that's what I would say.
Yeah. No, and we don't even have to get into that part of it.
That I could talk to, but I don't have the slide in front of me.
So, are you part of the Brookfield community? Do you live nearby?
So I don't live in Brookfield, but I live in New Berlin, and I am 7 minutes from the clinic.
Wow, okay, you're close. You're part of
Very
it. Tell me a little bit about, what you are most excited about opening up Compass specifically in Brookfield and the surrounding communities. I would just love to hear from your perspective as someone who lives there, why it feels so important and just what you're excited about.
Yeah. Well, why it feels so important when you look at the data in the state of Wisconsin and nationally, we know we're in a mental health crisis, and we know that it hasn't been easing. Incidents of suicide have risen 30% over the last 20 years, which is a terrifying statistic, to be honest with you. And we know that people are experiencing rates of depression and anxiety that are unprecedented. And so to be able to bring treatment that targets those specific things only helps our family, our friends, our communities, our schools, right? And so to be able to be another resource in an area that has a need is just really critically important.
What, in your opinion, as a professional who's been working in this field for a long time, or what are some of the signs people can look out for um, in their loved ones or their friends, their children, or that could signal like, hey, maybe an intermediate level of care would be right for this person. Could you kind of speak to that a little bit? Like, what are some signs just the everyday person can look out for?
I think the biggest thing to be looking for is that kind of they've stepped away from life or they're having a harder time engaging in life. So I alluded to it a little bit earlier, but difficulty getting out of bed, difficulty going to work or school, or maybe, an adolescent who is in school, but always asking to come back home because they're anxious about being in school. If you're noticing somebody being really isolative, they don't really want to talk to friends, they don't want to talk to family. Those are some of the really big ones. And maybe even that you've noticed that they're starting to have a drink at the end of the night because they're just really stressed out. And PHP and IOP really is about being able to recognize that they're starting to step out of life and how do we help them step back into life because whatever they're experiencing has gotten so big that they're starting to avoid it, or just avoid life in general.
Yeah. Do people have to try weekly therapy or weekly one-off psychiatry visits prior to coming to Compass?
No, not at all. So if you're seeing that in a loved one, if you're seeing it within yourself, a child, give us a call and we can talk you through it. We can ask a lot of questions that'll help us understand your particular situation and help make a recommendation. And maybe that recommendation is like, actually, you probably could do this in outpatient. However, it's if you're calling us at that point in time, it's probably a good idea to get into a partial program so that we can help avert it from getting worse.
If someone is referring a patient to us or a patient is calling themselves or for a loved one, but actually we do the assessment and we've determined that they would be a better fit somewhere else. I would love for you to speak to that.
Absolutely. And so, if that's the case, we're going to give you some referrals. So, we're going to help you find the right place so that you're getting the care that you need at whatever level that is.
Yeah. Okay. Love that. Okay, two final questions. Looking ahead, what's kind of the one thing or a few things that you really hope to build within our Compass Brookfield location in terms of the culture, the community there?
Thanks, Britt. I love this part. And we've already started this. So we're open. Our team has been with us training for 6 weeks ahead of our open. I think when we talk about how do we build a culture, we first have to start with values. And Compass has an amazing set of values. And the first and primary is how do we bring compassionate, data-driven, evidence-based care each and every day. So we're always talking. We have a huddle every single day, and we're always talking about, how are our patients doing? How are they experiencing our care? Then I think secondarily, it's how do we take care of each other as we take care of patients? We know that this work is so rewarding and so hard at the same time. And so as we're experiencing individuals' difficult stories and pouring into them, how do we pour into each other so that we can keep pouring into our patients, if that makes sense? So being here to support each other, sometimes that's being an ear, right? Sometimes that's, let me take this. Why don't you go for a walk and, take a little you time. And and just each day coming together to make sure we're taking care of each other. Yeah.
Love that. I'm curious, what was the feeling on site on opening day? What did it feel like?
There was a lot of clapping, a lot of laughing, a lot of smiling. Everybody is just so incredibly excited to be here. So, really, we're in celebration mode.
It's amazing. Okay. Final question. Is there anything that I've missed that you want to speak to that I haven't asked you that you think would be really important for folks to know?
Yeah, I guess I would just say, I feel like we should have a tagline or something, but like when in doubt, just call. So, because, healthcare is just difficult to navigate. And so we can help you navigate it. Don't feel like you're alone. We're a resource. And so I think that would be the biggest thing that I would want to leave people with.
And that's such an important one. Just call. Will
Yeah.
help.